Hey y'all, welcome to July, the month that never lies. You see what I did there? See what I did there? Huh? Huh? My name is Generous Jacobo and welcome to my YouTube channel. If this is your first time seeing my face, please don't make it your last by clicking on the subscribe button. And if you're a returning subscriber, this is for you. Now, the month of July is a very special month in my career, in my life, and also in the lives of women. Why? Because it's Fibroid Awareness Month, and I'm wearing white in honor of that. But before we proceed, I just want to put this disclaimer out there. I am not a doctor. Although some of you may have seen this photo of me where I was wearing scrub and I was a doctor for a day. I will tell you guys all about that in another video, but for today, let's focus on fibroids. But bear in mind that everything you're going to hear in this video has been confirmed from a gynecologist through my time in healthcare and through my personal consultation. Although I would also advise you to seek your own findings by speaking to a professional. So fibroids. What are fibroids? Fibroids are non-cancerous growth in the uterus that occurs during a woman's childbearing age. Now, they say it's between the ages of 30 to 50, but we've seen women younger than 30 who've had fibroids. So I think we should just stick to the status quo of during childbearing age. Now, research has shown that 70 to 80% of women will have fibroids in their lifetime. And in that percentage, Black women are 3 to 5 times more likely to have fibroids. Now, I don't know what we did, sis, but hey, there you go. Prior to my time in healthcare, I had this conversation with my mother once. I think I was still a teenager, and she was trying to explain what fibroid was. And she said, fibroid is like a baby, or they said it's like a baby, that it grows in your womb like a baby, and then it breathes and lives and feed off your blood. And I'm like,
I never expected it.
But I kept wondering, how can you have something in your womb that it's like a baby, but it's not a baby? Right? But after I got into healthcare, I realized that she was not far off from the description. Some of the symptoms are alike, like pelvic pressure, which is more like what you have when you're pregnant, you feel pressure. So some of the symptoms of fibroid are heavy menstrual bleeding, prolonged period. Of course, we know that the average period time frame is between 3 to 7 days. If you have your period shorter than 3 days, it is abnormal. If you have your periods longer than 7 days, it is abnormal. So fibroid comes with prolonged period, right? So you have pelvic pain or pressure, frequent urination, and some women even have backache or leg pain. Now, if you're a woman and you're watching this video and you regularly have your period, which comes with probably mild cramping to no cramping at all, you will understand just how uncomfortable it is in that time, even with no cramps or with mild cramps. Now imagine that mild cramp times 3 or times 10, bearing in mind that we have different thresholds, right? So I've met with women that said that when they had fibroids, they used to dread having their periods because of how uncomfortable and all the discomfort it came with. I mean, for me, that time is so...
I'm living in pains. I'm emotionally stressed. I'm emotionally downcast. I am so confused of all about life.
Now you may be wondering, how do we fix this? Or do women just go on living their lives with this discomfort? Well, the good news is there are treatment options available for fibroids. However, the treatment depends on the size of the fibroids, the number of the fibroids, and the position of the fibroids. Now, remember we said that the fibroid grows in the uterus. Now, for position, there might be some fibroids that are outside the uterus, and there are some that grows inside the uterus, which is typically where a baby grows. Now, if you have fibroids that are inside your uterus, this could hinder conception. It could cause infertility because the fibroid is taking the position of the baby. So there's no implantation, there's no space for fertilization to take place. Now, for number, you could have multiple fibroids. You could have, 1, 2, 3, depending. And for the size, is ranging from a pea size to probably the size of a baby. Now the treatment options are hysterectomy, myomectomy, which is also of two types. Myomectomy is open and laparoscopic myomectomy. Now, the first time I heard hysterectomy, myomectomy, I'm like, what is this? You know, it's like, what's all the knees and scopic and all that, you know, but my doctor was kind enough to explain it to me. And hysterectomy is a total removal of the uterus. Now, if you want to say, be done with it, I don't want any kids, or I don't want any reoccurring fibroids, because fibroids can come back even after you take it out, right? So if you want to eliminate that option of or having it come back in the future, or eliminating every option of having children, you completely take out the uterus so that the fibroids have nowhere to grow or exist. That's hysterectomy. Now, hysterectomy is not your only option for fibroid removal. If your doctor is giving you that as the only option, run. Please
run.
Now, for myomectomy, it's of two types. You have the open myomectomy and the laparoscopic myomectomy. So for the open myomectomy, like the name implies, it involves the complete opening up of the tummy, probably from the bikini line, and the doctor goes in and takes out the fibroid from your uterus. For laparoscopic myomectomy, however, unlike the open myomectomy, they don't open you up. The doctor goes in with cameras. They make tiny incisions in your belly, and it goes in with cameras to see what's inside. You know, prior to that time, there must have been a scan, but then they go in with cameras and then they shred the fibroids and take them out piece by piece without leaving the big scar on your bikini line, like what they do with the open myomectomy. Now, it takes a very skilled professional to perform a laparoscopic surgery on you. I mean, it's not very common, it's not very popular. It takes a lot of work and a lot of time, and it takes a skilled person, doctor, to perform a laparoscopic surgery. And bear it in mind that for a laparoscopic surgery, it also depends. Not everybody would go for that option or go for open myomectomy, because it depends on your type of fibroids. So your doctor would advise you based on your case. There are also non-surgical treatment options for the removal of fibroids, which involves the use of injections like Lupron, Zoladex, and the likes, and it's basically to shrink the fibroids so that it doesn't affect you as much as it normally would. So please know your options. Don't take concussions if you already know that you have fibroids. Don't drink anything to shrink it. Don't insert anything into your body. We've heard stories, I've heard stories of people who took concussions without seeing a doctor, and it was tragic, really tragic. Please, the first step, if you suspect you have fibroids from these symptoms that we've mentioned, just go to a hospital, go and do a scan. Right? Scans are relatively cheap. I think it costs between 4,000 naira to 15,000 naira, depending on the hospital or the lab. So you can do a scan just to confirm if you have fibroids or not. And if you have confirmed that you have fibroids, don't freak out. Just, in fact, scratch that. Freak out. Because it's a lot to take in, but just know that it's fine. You know, you're going to be all right if you are in good hands. If you finally decide, okay, I want to take it out, I want to go for surgery, do your research, go to a good hospital, right? During your first consultation with your doctor, ask questions. Ask your doctor a lot of questions, right? You know, let them know your fears. And if your doctor is getting exasperated because you're asking them questions, again, sis, run. The doctor should be able to answer all your questions. Now, there are a lot of hospitals right here in Lagos that performs myomectomies, both laparoscopy myomectomies and open myomectomies. In fact, there are a lot of hospitals here that do fibroid surgeries. I would mention them, but I'd rather not. So I would advise you to do your research, go online, search for these hospitals, check out their success rates, check out their reviews. You know, if something is good, people will tell you, and if it is trash, most likely people will tell you. Better believe that. So just do your research, go for the best doctors. As long as you're in good hands, just know that you're going to be fine. Having fibroids is not a death sentence. It is not the end of the world, and it's definitely not the end of your life. Okay, so that's all for fibroids that I know from a non-medical perspective. This is my little contribution to Fibroid Awareness Month. I hope you've learned something from this video. I hope this video wasn't too long, and I hope that if you or someone that you know has fibroids, you will get the right help, you will get the right treatment, and you will be safe. Thank you so much for listening to me, and I will see you in